without being scared of being judged. Okay. And it is a safe learning environment where you can ask all your questions, no fear of judgment. It is a supportive atmosphere, and there is an understanding setting which will help the students achieve their best. Hard copy notes that is also provided. So these hard copy notes have a lot of images, and they also are very colorful, giving students a picture skew memory. When there's a picture skew memory, it becomes easier for you to recall and write your paper. Okay. And there are a lot of flashcards, a lot of flow charts to make your learning journey easier. Coming to the Q bank, the Q bank is highly updated and it is highly effective. There are three levels of levels that are there in the Q bank. You have beginner and it goes up to the expert level. And this Q bank is completely customizable. That is, whichever topic you are studying, you can choose the questions from the same module and you can solve them. You can use it as an active learning tool. After you've finished studying, if you try to actively try to solve these questions, you will try to remember things for a longer time. It is going to cover MCQs for Proff exams, NEET PG, as well as FMG. So everything is taken care of. Coming to the practical sessions, here we try to give you a hands-on experience about the various case scenarios, about anything that will come in your practicals. Usually what happens, there is a gap, okay, between when practicals happen in your college and when you'll be giving exams. And meanwhile, what happens, students forget what all was taught in practicals. In order to cover that gap, we are giving you practical sessions so that you know what kind of case scenarios are there, you know how to approach them, and it's like a last minute revision tool for you just before you go and give your practicals. There is expert guidance given to you, not only in terms of case scenarios, but also about the probable spotters that are there, as well as the viva voce questions that will be asked. Okay, so once you have grip of all of these, it is easier for you to go and give your practicals. Now, coming to the various subscription plans that are there, we have the foundation plan, advanced learning plan, complete learning plan, as well as ultimate MBBS plan. Coming to the foundation plan, this is for a time period of 3 months where you have pre-recorded classes, you have live classes, express exam module, practical sessions, as well as QBank. So all these are there in your 3-month foundation plan. And then you also have advanced learning plan where you have these 5 things, and here it is for a period of 6 months. Apart from this, you also have the complete learning plan where you have all these 5, and additionally you also have hard copy note set and one-to-one doubt clearing sessions. So all these are available for you. And then we have the ultimate MBBS plan where there are pre-recorded classes, live classes, express exam module, we have practical sessions, QBank, hard copy note set, and one-to-one doubt clearing sessions. So the extra things are the hard copy note set and the one-to-one doubt clearing sessions. And because it's ultimate, as the name suggests, it is for a period of 4 years, so that you're taken care of through and through throughout your MBBS. Okay. Now coming to the topic per se, the topic is about death. So we'll be looking about death, the study of death, and various causes of death. Now, coming to the first question, define thanatology and types. Now, coming to thanatology, what is thanatology? It deals with death in all the aspects. So, thanatology is nothing but death, and all the aspects of death studied together is called as thanatology. So, there are 2 types, okay? So, one is somatic death and one is molecular death. So, these are nothing but the types of death. Now, what do you understand by somatic death? It is nothing but complete and irreversible stoppage of circulation, respiration, and brain function. 3 things. Circulation, that is blood flow is stopped, respiration is stopped, brain function is stopped. So when all these 3 stop, these 3 are called as Bishop's triad of life. Then it is called as somatic death. Now, what is molecular death? Molecular death in the sense, death of individual organs or tissues. That is what happens. Normally, when a person dies, we tell a person is dead when the respiration has stopped, circulation has stopped, and what's another thing? Brain function. After the somatic death happens, there is a specific time up till which the organs are still alive, okay? So that is called molecular death. The time when those organs also die is called molecular death. And for various organs, it is different. Now, let's see how much is it. For heart, it is around 60 minutes. So this is the time when a transplant can be planned. For liver, it is 15 minutes. For kidney, it's 45 minutes. For blood, it is 6 hours. And for bone marrow, it is 6 hours. So this is the time taken for the molecular death of these organs to happen. Okay, got it? Now, coming to the next question, we have to study about the brain death, the criteria, and the medico-legal importance. What do you understand by brain death? Brain death means irreversible. It has to be irreversible loss of brain and the brainstem function simultaneously. That is, the functions of brain is also gone, and the function of brainstem. Brainstem has all the vital centers, no? Centers for respiration, center for digestion. So there are so many centers in the brainstem, and everything is gone. Then we call it as brain death. It does not include death of cortical area of the brain. So this might be asked as an MCQ. Brain death does not include what? It does not include the cortical area of brain. It includes only the stoppage of all the functions of the brain and the brainstem, and it should be irreversible. That is, whatever thing you do to, in order to bring it back, you're not able to bring it back. It is irreversible. Then we call it brain death. Now, brain is responsible for the coordination between all the organs. We know, if brain doesn't function, there's so many people who are brain dead, no, but their organs are still functioning. But we know that if the brain isn't there, it can't coordinate the function of other organs. That is why the presence of proper functioning of brain is very important. Once the brainstem death has been established, no matter how healthy an individual, life will not return. That is why for the brain dead patients, they suggest them to do organ donation, because no matter the brain function won't come back, so the person won't be alive, but his organs are still functioning. It could save life of somebody else. So if somebody is brain dead, they suggest them to go and do organ donation. Got it? Even with continuous cardiopulmonary support or whatever means they try, there won't be any brain function. This is what you have to understand. It is a irreversible thing. What is the criteria for determining permanent non-functioning of the brain? There should be unreceptivity and unresponsivity. That is, to pain, touch, changes in temperature, to any of these, there won't be any response. There won't be any receptivity. That is called as unreceptivity and unresponsivity. And if they try giving certain injections, if they try giving adrenaline, if they try giving atropine, there won't be any reception, unreceptivity. No movements and breathing. There won't be any breathing movement. You won't, when you try to feel the breathing, you won't see any breathing. No reflexes. That is, if you try to elicit a patellar reflex or any other knee reflex, any other reflex, there won't be any reflex. A corneal reflex, all these are going to be absent. Okay. Now coming to the EEG, what is EEG? Electroencephalogram. You see the EEG, it is going to show a flat line. So EEG is a confirmatory tool to say that the person has undergone brain death. So what is a confirmatory tool? It is EEG. Got it? Now, coming to the diagnosis of death. How do we diagnose death? Brain death is declared when there is permanent fixed bilaterally dilated pupils. That is, if you look at the pupil of a person, you can see that it is going to be dilated. So what is dilated called as mydriasis? No? In your pharmacology, you would have studied. So there is going to be permanently fixed. That is, whenever you try to shine a torch or bring something near the eyes, it is not going to move. It is fixed and dilated. If you look at the eyes, the pupils are widely dilated and it is going to be fixed. Got it? Next. There is absence of all the reflex. As I told you, corneal reflex, conjunctival reflex. How do you do a conjunctival reflex? You bring a cotton piece where a small thread is brought out and you try to rub it along the conjunctiva. And then normally what happens, the person tries to close the eyes. But here, because the person is brain dead, there won't be reflex seen. Corneal reflex is not seen. Any other deep or superficial reflex is not seen. There is cessation of respiration without aids. That is, if you remove the person from ventilator, you'll see to it that the respiration completely stops. Only with some help, he might be respiring, but once he's taken off from the machine, from the ventilator, the respiration stops. Okay. Cessation of cardiac activity. So when the cardiac activity stops, how do you see a EEG? There is going to be a flat line in the EEG. There is going to be an asystole, and it's continued asystole. There's going to be a flat line which says that the person has died. There won't be any cardiac activity. So if you see the EEG, it's going to show a flat line. Got it? Now, coming to the next question, vagal inhibition. What do you understand by vagal inhibition? Vagal inhibition refers to the suppression or slowing down of the physiological functions controlled by vagus nerve. So in the question, imagine you don't know this topic and you have this question and it says vagal inhibition. So looking at vagal, what do you understand? The question is saying something about vagus nerve. Inhibition means the function of the vagal nerve is brought down, it's slowed down or stopped. This is the meaning of vagal inhibition. So when the vagal nerve's function is stopped, what is going to happen? Vagal nerve, no, it's going to control so many functions in the body. And when we try to slow it down, all these functions are going to be reversed. Okay, that is what you need to understand. So in a lot of questions, especially in the subject of forensic medicine and toxicology, you have to use a lot of your common sense. Okay, every time there will be a one or two bouncers which you wouldn't have studied. Try using your common sense. Mostly it will be right. Okay. Now, this vagal nerve is a component of sympathetic or parasympathetic. Try to recall physiology. It is a component of parasympathetic nervous system. Now, normally what does vagal nerve do? See, heart rate reduction. The vagal nerve normally slows the heart. The normal function of vagus nerve is to bring in bradycardia. It is going to decrease the heart rate. It is going to slow the heart rate. But when we inhibit, there is going to be, what did I tell you? All the functions are reversed. So what happens? There is going to be tachycardia. There is going to be increased heart rate, that is seen. It can occur during stress or through sympathetic activation. Got it? So whenever they ask you a question about vagal inhibition, write 2 or 3 points about what could happen because the vagal nerve is inhibited. Number one, there is going to be tachycardia. Put a heading and then explain about what will happen. Okay. So next one, inhibition of digestion. So vagal nerve usually, what happens? Vagal inhibition may suppress the gastric acid secretion, motility, and enzyme release, potentially contributing to digestive issues and decreased emptying. So what happens normally? A vagal nerve facilitates digestion. There is going to be acid secretion. There's going to be increased motility in the gut. All the enzymes are activated, because of which there is going to be for digestion, better digestion that is happening. But when the vagal nerve is going to be suppressed, there's going to be inhibition of digestion. So what are the 2 points? Tachycardia and inhibition of digestion. Respiratory rate modulation. Vagal inhibition can also affect breathing patterns. Inhibition of the vagal nerve may result in faster and more shallow respiration. So normally, what is a see, in the heart rate also, the normal function was to slow down. Okay, here also in our respiratory rate also, normal function of vagus is to slow down. But now when we have inhibited, there is going to be a faster respiration, and it's going to be a more shallow respiration. That is, it's fast, no? So there's no enough time for them to take a lot of breath. It's not deep, it's very shallow. The movements that you can see in the respiratory are very shallow, and there are number of movements like this. Got it? And now coming to blood pressure, we'll see what happens in blood pressure. So as I told you, normal function of vagus is to slow down everything. In digestion, it was reverse. Okay, digestion is facilitated reverse. The digestion. Now coming to blood pressure, normally it is going to what? It is going to slow down. But now because it is inhibited, it is going to increase the blood pressure because its regulatory effect is gone. Okay. After discussing all these points, so we will sum up these ones again. Okay. Coming to stress and anxiety response is acceleration of heart rate, other stress related responses. So basically, we know that whenever we are stressed for something, if we try to feel a heart rate, it is going to be increased. It's the same point that we discussed about tachycardia. That basically, they are saying that the stress, the person experiences more stress and anxiety. Coming to the immunological impact, this vagal inhibition could lead to increased inflammation in the body, which may have implications in conditions like chronic stress and autoimmune disorder. So all these problems, all the inflammation and stress related problems are going to get accelerated. So now we've discussed about these. No, try recollecting and tell me what all happens whenever the vagal nerve is inhibited. For it, to use your common sense and write about it, you need to have thorough physiology knowledge. Okay. So what happens is going to be tachycardia, increased heart rate. There is going to be tachypnea. What is tachypnea? Tachypnea is a term which says that there is going to be increase in the respiratory rate, increased heart rate, increased respiratory rate, decrease in the digestion, increased inflammation, increased stress in the person, all these. Okay. Now, coming to the next question. Obscure autopsy. What do you understand by obscure autopsy? Obscure. What do you understand by obscure? Obscure means yes or no. You're not able to come to a conclusion. It is yes or no. Then it is called as obscure autopsy. You don't know whether it is yes or no. An obscure autopsy typically refers to an autopsy where the cause of death is not immediately clear or the circumstances surrounding the death remain ambiguous after an initial investigation. So if you can see the first point here, in the first point, it's a short, no? So initially give an introduction about your answer. So when they ask about obscure autopsy, you need to write about what do you understand by the term obscure autopsy. That is, you do not clearly get to know what is the cause of death. Okay, so that is meant by obscure autopsy. There's going to be unclear cause of death. In some cases, the cause of death may not be immediately apparent from the external examination or preliminary test. So what happens whenever a dead body comes to you, do the autopsy, no? You do external examination. You look at the color of the skin. You look at the any other injury marks that are present, cut marks, firearm injury, snake bite. All these you check upon. In these obscure autopsy, nothing can be found out from external examination or after doing certain preliminary tests. And it is so because all these responses can be very subtle or very mild, because of which you may not understand what is the cause of death. Now, Coming to natural versus unnatural causes of the death. The autopsy may be unable to conclusively determine whether the death was due to natural causes. What are the natural causes of the death? Some bodily impairment that caused death. For example, heart failure, stroke. These are all the natural causes of death. Or if it was a result of foul play, such as homicide, suicide, or accidental. So, obscure, no? So you do not know whether it was a natural cause of death or whether it was an unnatural cause of death. So whenever there is a death coming to you, your very simple thing or very basic thing as a doctor you're expected to do is firstly find out whether it's a natural cause of death or unnatural. Why? Because if it is unnatural, there is police investigation involved in the case. Okay, it becomes a case of medical legal importance. So to find out whether it was natural or unnatural becomes a primary goal, and in obscure autopsy you will not be able to find out this. Okay, that's why it's called as obscure. There might be some atypical symptoms or pathological findings. So what happens sometimes, the deceased person might have led to unusual or atypical symptoms leading up to death, and because the symptoms are very vague, you won't be able to find out what happens, the unusual or atypical symptoms. He might have certain rare diseases, genetic disorders, or infectious disease which is not easily identifiable. So what do you understand by this? So usually what happens, for a setting like India, you have certain conditions that come to you. Okay, for example, a cardiovascular accident, a stroke, or persons dying because of hemorrhage. All these are the things that you see on a day-to-day basis, and you'll be easily able to tell the cause of death. But in certain conditions, for example, a moya disease that has come to you, you won't be able to tell about what happened in the person unless or until you also do a virtual autopsy. That is, you use your radiological investigation, CT, MRI. If you don't use, you won't be able to find out, no? Because it is a rare thing and doctors seldom see it. Okay, so in such cases there could be obscure autopsy. There is lack of witness information. In cases where no witnesses are available or when there is conflict in testimony, it can be difficult for the medical examiner or the forensic pathologist to discern if the cause of death was accident, deliberate harm, or natural cause. That is what happens when whoever comes to give you testimony, whoever tries to come and give you evidence, if whatever they say are conflicting, that is, one person says he died because of a heart attack, one more says he died because of an insect bite, like different people are coming and telling you different things, it becomes difficult for you to understand what was the actual cause of death. Okay, if there is toxicology or substance use involved, the presence of drugs, the presence of alcohol or poisons in the body may complicate an autopsy. So if there is a substance that a person is injected which is not immediately detected, that is, if the detection takes a little longer time, in such cases it is difficult for a doctor to find out the cause of death. Some poisons or drugs might leave very trace evidence. Like, for example, we have discussed in toxicology about ideal homicidal poison. What is one of the ideal homicidal poison? It is nothing but thallium. So what happens when it is an ideal homicidal poison? It is very difficult to diagnose. It is called as ideal for a reason. No, there won't be any traces of poison left. It is easier. It is difficult to find out. There's no antidote. There is no cure. Like, there are no other symptoms also seen. So if the person has died by consuming one of those, it becomes difficult for the doctor to find out what caused the death, and becomes a little challenging for the doctor to give a proper report. So these are the cases where obscure autopsy occurs. Now, obscure, as I told you, it was yes or no, right? This is nothing but obscure. Negative autopsy. What do you mean by negative autopsy? Negative. That is, even after you do every possible investigations that is there, you try to break your head to find out the cause of death, you do virtual autopsy, everything, but then even then you do not get to know the cause of death. You don't know. It's negative. You do not get to know the cause of death. That is, when gross microscopic examination, toxicological analysis, and laboratory investigation fail to reveal the cause of death. Even after you do n number of tests that are out there, you won't be able to guess the cause of death. So how much percentage of all the autopsies are negative? That is, you do not know the actual reason. 2 to 5% of the autopsies could be negative. You do not know the cause of death. Now, why are negatives autopsy? Why are some of the autopsies negative? Even though we're doing so many tests, is it really possible for us to have a negative autopsy? might be the reason. There could be inadequate history, that is, death from vagal inhibition, status epilepticus, or a hypersensitivity reaction. If there's a vagal inhibition, for example, a person went to take a dive in the pool. Instead of diving properly, he just fell, horizontally. So in such cases, there could be vagal inhibition because of the sudden impact. And vagal inhibition is not something that you note very easily. Okay, so there may not be any person who tells you that such and such things actually happened. So these are the causes where you may not understand what happened to the patient because you aren't given proper history. The history is inadequate, which can lead to negative autopsy. Inadequate external examination, that is, even after you try to vigilantly look at everything, there could be some needle marks that are missed, very tiny sui marks, needle marks. What are sui? We studied, no, suis are nothing but made of arbris precatorius, which are used in cattle in order to kill them. It could be used in humans also. So if the mark is very fine, it is difficult for us to identify. Or if the death is from snake bite, insect bite, or electrocution burn, where there won't be any external changes seen at times, it becomes difficult for the doctor to identify the cause of death. Inadequate internal examination, air embolism, pneumothorax. So these are not easily seen every day. No? So a doctor might tend to miss out on these things, which could be the cause of death. Lack of toxicological analysis, a very remote place where toxicological laboratory might be very far to reach from, and if the relative is not consenting for all that time lag, then certain things could be missed out. Or in worst of the worst scenario, if the doctor is not trained properly, even then certain things like this could be missed out. So these are the causes for a negative autopsy. Now let's look at sudden death. What do you mean by sudden death? WHO defines it as a death which occurs in 20 hours. Sudden. What do you understand by sudden? That is, somebody tells you, doctor, this person was fine yesterday, but today he's dead. It's a sudden thing. And it happened all of a sudden, within 24 hours, within one day. Then it is called as sudden death. Okay, so it has to happen to a person who doesn't have any symptom. That is, he's perfectly fine, suddenly died. Or yesterday only he started developing vomiting and loose motion. Doctor, today he's dead. He developed certain symptom, but after that also death occurred within 24 hours. Okay, then also it is called as sudden death. This time period is considered too long by some pathologists, and they consider 1 hour as the time frame that can be used for sudden death. Okay, but we do not have to worry about it. Something which is sudden, like something like yesterday he was unwell and today he died. All these is sudden. Okay. Now, coming to what other points you can write whenever a question of sudden death is asked. The death is so sudden, the person was totally fine, that you might think that there could be some foul play that is involved in the cause of death. 80% of such deaths are natural, whereas 20% could be unnatural. Okay, so always there is a chance, no, of a foul play that is involved, like that. Okay, now coming to the manner of death, as I told you, 80% could be natural, whereas some around 20% could be unnatural. So this you have to understand. So whenever a question of sudden death comes, first what you'll write the definition. What is sudden death? Suddenly it has to happen, or after the first symptom in 24 hours it happens. First point. To the point, you get your 1 mark. Next point. What is the manner of death? 80% natural, 20% unnatural. The second point. Okay. Now coming to the natural deaths, if the sudden death was because of a natural cause, what could be the causes? This occurs due to some disease. Okay, it could be a pathological condition, old age, or a debility in a person. So sudden death is seen in a lot of old people, no, who are above 65, above 70, 75. A lot of them die out of a cardiac arrest. So it is a sudden thing. That is why old age and debility is mentioned here. Okay, there could other causes include cerebral thrombosis and subsequent infarction. The person doesn't take his medicines properly, he develops thrombosis, and then he might die. Cerebral embolism, meningitis, tumor of the brain producing pressure. What is it called as? If there is a tumor which produces pressure in the brain, what is it called as? Hydrocephalus. So all these could be certain causes of sudden death. Tumor of the brain with sudden hemorrhage. Because of hemorrhage, the person might go into hypovolemia and the person might die. Metabolic disorders, for example, uremia. Cardiovascular condition, for example, MI. Myocardial infarction, which is one of the major causes of sudden deaths in India. And certain respiratory conditions like severe asthma or COPD. So the third point for you to be to write about natural death and give 3 to 4 examples of natural death. For example, you can write about cardiovascular condition MI, easy one to remember. You could write about about the cerebral thrombosis, another easy one, severe asthma, COPD, and meningitis. So these are the simple and easier ones that you could remember and write in your exam. Now, coming to the unnatural death, there could be various reasons for unnatural death. It could be accidental, suicidal, or it could be homicidal. So one of these could be the cause of unnatural death. Now, coming to the examples of unnatural death, you can write about any unnatural deaths. Okay, you can write about any accidental head injury. These are the certain examples that I have given. You can write any other examples that could come to your mind for an unnatural cause of death. Accidents, for example, a road traffic accident, homicidal stab injury, injury to the head, like for example, a stab injury, laceration, incision, firearm injury. So all of these, or a suicidal head injury, for example, a firearm injury, poisoning like opium or alcohol. So all these are the causes of death. Okay, so you can write any other cause that you remember during your exam. Now, coming to the next question, suspended animation or apparent death. So this is the last question, okay? So this is the last and the most important question in this topic. So what do you understand by suspended animation? Suspended animation means apparent death. What do you understand by apparent death? Not fully dead. Then why is it called as dead? It is because here all the bodily functions, for example, the heartbeat, respiration has all come to such a low pitch. Okay, they're so weak or so feeble that you cannot detect these when you do normal clinical examination. That is what's called apparent death. That is, all the vital functions are so low that you feel like the person is dead, because when these respiration, heart rate are so low, you cannot easily detect them using the steth. Okay, now coming to the types, you have two types. You have involuntary as well as voluntary. Now coming to involuntary, so involuntary, that means the person doesn't want to die, okay, or the person does hasn't done it by himself, but there might be a circumstance which has led to his bodily function, his vital functions coming to a very low level. For example, a person who has drowned, a newly born infant, before you do this, you rub the back of the baby, you try to flick on the soul of the baby in order to bring in all these reflexes. So certain times in the newborn baby also, all the vital functioning could be very minimal after anesthesia, because the anesthesia would have slowed down all the functions. There could be a suspended animation scene, cerebral concussion. That is, whenever there is a head injury so severe, there could be cerebral concussion, and because of cerebral concussion, all the vital functions could come down because of that sudden stress. Electrocution, heat stroke, mesmeric trance, and prolonged illness. So all these are the various examples stating that the bodily functions have come down. So what bodily functions are we talking about? Mainly we're talking about heart rate as well as respiratory rate. So these two functions have come down to such an extent that you cannot clinically detect them. Now, these are all the involuntary causes. So now you might ask, Mama, is there any voluntary cause also where a person might seem like he's dead? It is by the yogis. These yogis, they can go to such deep levels of meditation where from outside, when you see them, you might feel like they are dead. But in certain states, when they go into such a deep state, they might even die. Here, I'll give you an example. You know Sadhguru, right? Who is Sadhguru? Sadhguru is somebody who's founded the Isha Foundation. So his wife apparently died because of this. So they try to control their breathing. They go into such a stage where every functioning of their body is slowed down, and certain times they can go into death also. So these were the various questions. Now let's discuss on certain MCQs, okay? I'm coming to the MCQ number 1. Which of the following is a primary focus of thanatology? So what did we study? What is thanatology? Thanatology means nothing but study of death and the various aspects related to it. So coming to the options, the psychological effects of trauma, the process of mourning and bereavement, the study of death, dying and associated societal and cultural practices, the medical management of terminal disease. So what is the answer for this? As you all know, the answer is option number C. Why option number C is the answer? Because as we saw, thanatology is nothing but study of death and everything that is related to death. Okay, so option number C is the right answer. Now let's look into the explanation. It is nothing but thanatology, study of death, dying and the related topics, including the physiological, psychological, as well as the cultural aspects of death. So in a whole, it is thanatology. Okay, got it? I hope all of you got this one right. Now, coming to the second question, which of the following is not typically a subject of study in thanatology? So, what is the question asking? What is not studied in thanatology? Let's look into the options, okay? end-of-life care and palliative treatment, grief and bereavement counseling, the impact of death on societal structures, the treatment of infectious disease. So what doesn't come under this? Option A, end-of-life care. Does it come? Grief and bereavement counseling, impact of death on the societal structures, and option D, the treatment of infectious disease. So what is the right answer here? The answer would be option number D. So why is option number D a right answer? Because all the other options are having to do something around death, but last one has to do with treatment. We are not studying about treatment in death. No, the person's already died. Why do you have to treat him? That's why option number D is the right answer. Now coming to the explanation, thanatology focuses on the death-related topics such as palliative care. Palliative care is, so there are certain people you know that they'll die no matter what. No, the care given to them. Grief counseling and social and cultural impact of death, but not the medical treatment of diseases like infectious diseases. Got it? Any treatment won't come under thanatology. Remember this. This might come as your MCQ. Coming to the third question, which of the following is a key criteria for diagnosing brain death? So let's look into the option. Keep in mind, you're studying about brain death now. Okay, so when you see these options, you need to focus on brain death. Complete cessation of respiratory function, irreversible cessation of all the brain activity, including brainstem, persistent vegetative state for more than 12 months, absence of reflexes in response to noxious stimuli. So in this options, you can see, every option is very interlinked. So what could be the key criteria? What is the key criteria? The key criteria is nothing but option number B. Why is it a key criteria? Because the word irreversible is mentioned here. Whenever the word irreversible is given, that means whatever you do, the person will not come back to his original state. There is irreversible cessation of brain activity, including brainstem. That is the answer. Okay. Now, coming to the explanation, brain death is defined as, that is a definition only. We studied, the second question was about brain death. We studied that as irreversible cessation of all the brain activity, including activity of brainstem, and is a legal and medical criteria for determining death. Got it? Okay. Now, let's look into the next question. Now, question number 4. Which of the following tests is commonly used to confirm brain death? So, we have 4 options. So initially what I told you about so many tests. No, among these tests, you have to tell which one is best. I told you that one of those might come as Viva OC, and now see, we have a question on it. EEG showing no electrical activity, MRI showing brain atrophy, cerebral angiography showing reduced blood flow to the brain, blood tests for elevated serum levels of neurotoxins. What is the right answer? Yeah, I can hear you saying the right answer is option number A, EEG showing flatline. It is a confirmatory test, whereas all the other things, as you can see, in a living person also, you can do all these tests. You can do a MRI, and then there might be brain atrophy in a very old person, and you could do an angio and see that blood flow to the brain is reduced. All this can be seen in people who are living also. So the confirmatory test for brain death is option number A, EEG showing no electrical activity. So coming to the explanation, an EEG showing no electrical activity in the brain is one of the standard tests used to confirm the brain test. It is a confirmatory test. Now coming to the question number 5, which of the following is the primary effect of vagal inhibition on the cardiovascular system? This is also application type of question. I told you, when at the end we recall, when we just saw the function of vagus nerve, we know that whenever it's inhibited, everything becomes ulta, it becomes reverse. So let's see. Increased heart rate, decreased blood pressure, slowed heart rate, increased blood flow to the brain. So blood flow to the brain, we have not studied only, so we will leave that option. Okay, so we have other 3. Now we are trying to eliminate. Slowed heart rate. Slowed heart rate, as we know, it is a normal function of the vagal nerve. It is going to slow down the respiration and heart rate. That is normal. Therefore, that is not the answer. We are going to find out vagal inhibition. When the vagal nerve is inhibited, what happens? Decreased blood pressure. Is it seen? Decreased blood pressure also, it is a normal function. So that is not the answer. When vagus is inhibited, there is going to be tachycardia. Therefore, option A is the right answer. Vagal inhibition leads to a decrease in the parasympathetic activity, resulting in increased heart rate. Got it? This is how we need to apply whatever you have learned. Coming to the next question. Vagal inhibition can lead to suppression of which of the following bodily functions? Digestion, sweating, muscle contraction, blood clotting. Now, the common sense thing that you can do here is we haven't B, C, and D, we haven't studied only because that is not important. That is why those cannot be the answer. The option is option number A, digestion and gastric motility. Let's see if it's the right answer. Yes, that is the right answer. The vagal nerve plays a significant role in digestion. That is, it increases gut motility, it increases the enzymes, it increases secretion of enzymes, all these. No, therefore, it facilitates digestion. Whereas whenever the vagal nerve is inhibited, there is going to be suppression of digestion. Coming to the next question. An autopsy is considered obscure when? What do you understand by obscure? That is, you're not able to find out what is the cause of death. Yes or no type of autopsy. You're not able to correctly identify what is the cause of death. It's called as obscure. The cause of death is immediately clear after the external examination. Option number A, is it so? Can you identify? No. There is no sign of foul play and the cause of death is easily identified? No. If there is no foul play and you can identify the cause of death, why is it obscure? So option number A, out. Option number B, out. The cause of death is uncertain or not easily identifiable after initial examination and testing. Okay. Coming to D, the death is classified as a suicide and clear evidence. If you know it's suicide, then it's not obscure. So what is the answer here? It's a very simple question. The answer is option number C. Okay. Now coming to the explanation. An obscure autopsy occurs when the cause of death is uncertain or not immediately identified, requiring further investigation such as toxicology and histopathological analysis. Because you do not know the perfect cause of death, it's called obscure, and the correct answer is option number C. Coming to the next question, which of the following factors may contribute to an obscure autopsy? Okay, so this question is also about obscure autopsy. Let's see the options. A clear medical history and recent physician diagnosis. So everything is clear, then why will the autopsy be obscure? No, we know everything properly, then there's no question of obscurity. Coming to the next option, the presence of undiagnosed medical conditions or rare disease may be, the person has rare disease or something is undiagnosed, could be a cause of obscure autopsy. Option C, a well-documented uncomplicated death. If it's well-documented, it's not an obscure death. A sudden expected death with no history of trauma. It's expected, no? Then it cannot be obscure. So the right answer here is option number B, the presence of undiagnosed medical condition or a rare disease. Let's look into the explanation. Undiagnosed medical conditions, rare disease, or subtle pathological findings that are not easily recognized can contribute to an obscure autopsy, making the cause of death difficult to determine. Got it? Coming to the next question. What does a negative autopsy typically indicate? Now the question is about negative autopsy. The cause of death is determined to be natural with no contributing factors. Okay, here we know a cause of death, no? So that cannot be answer. Coming to option number B, the autopsy reveals no physical evidence of disease, injury, or other identifiable cause of death. Okay, so after autopsy, it says nothing has happened. Option number C, the death was a result of unknown toxic substance. Okay, you know that a toxic substance caused the death. Option number D, the autopsy conclusively identifies foul play or trauma as the cause of death. So what here you can see in option number A, option number C, and option number D, we know what is the cause of death. Whereas in option number B, the autopsy reveals no physical evidence. You do not have any evidence of a disease, injury, or any other cause of death because you do not have any injury suggesting, any evidence suggesting a death. That is why it is called as a negative autopsy. So option is B. A negative autopsy means that the autopsy revealed no physical evidence of disease, trauma, or other identifiable causes of death, making it difficult to determine the exact cause. Got it? Now, coming to the question 10, suspended animation refers to. So what does the suspended animation refer to? Coming to the options, a state where a person is clinically dead but can be revived with medical intervention, a condition where the body shows no vital signs but it can be reversed through external stimulation, a medical procedure where a person is put into a deep coma for long-term healing, a state of reduced bodily functions where the heart continues to beat but the brain is inactive. What is the correct answer here? Option number A, is it correct? A state where a person is clinically dead but can be revived with a medical intervention. What is the answer here? The answer is What is the answer? Option number B, it is a condition where the body shows no vital signs, or the vital signs are so minimal that you feel like the person is dead. So that is the answer. So these are the 10 questions that we discussed. Coming to the next question, we have the last question for today. Coming to the next question, which of the following scenarios is most likely to involve suspended animation? So this is also a question on suspended animation. A person in the deep coma with no response to external stimuli, but with preserved brain activity. Okay. Coming to option number B, a person experiencing cardiac arrest but is revived after a period of hypothermia or induced cooling. Option number C, a person who is in a vegetative state with complete brain function. Okay, option number D, a person showing signs of severe dehydration and electrolyte imbalance. So what is the correct answer? You know about suspended animation. What is the correct answer? It is option number B. A person experiencing cardiac arrest but is revived after a period of hypothermia or induced cooling. That is, some activities come down very minimally, but you try to revive him. That is called as suspended animation. Suspended animation is often observed in cases of hypothermia or induced cooling, where metabolic processes are slowed and cardiac arrest is reversible after a period of reduced bodily function. That is, you can reverse the condition of the patient after giving proper resuscitative measure. This is nothing but suspended animation. That is, in suspended animation, the person is not dead. You can try to do something in order to restore the person's living. That is meant by suspended animation. Got it? So I hope you have understood the chapter well, and all these MCQs are the active revision of whatever we discussed in this session. Okay, so I've put in MCQs from every topic that we discussed today, so that you can benefit from it, and it is easier for you to understand how you need to apply all these topics. Okay, thanks for watching, and we'll meet in one more class with one more topic. Thank you.